More than a year after the first case of Covid-19 was reported, some countries and regions appear to have the pandemic under control. But many others continue to report record high numbers of new infections every day. So what are some places getting right? And why aren't others following their lead? New Zealand, Australia, Taiwan, and the Chinese mainland are among those managing to put a lid on COVID-19.
The countries and territories that have been successful in limiting the spread of COVID-19 have generally acted decisively at the start and then did so again when subsequent outbreaks occurred.
The disease containment success stories have common themes: tightened border controls, introduction of strict lockdowns, sophisticated contact tracing, and above all, ability to quickly learn what does and does not work. In the process, economies have ground to a halt. Many jobs have also been lost. But these types of containment strategies have worked.
Many of the countries that responded very well at the start of the pandemic had previously experienced the SARS-CoV-1 virus in 2002 and 2003. And so they had this track record and this experience of knowing how to respond.
Taiwan and Hong Kong are two places that were hit hard by SARS. The lessons learned nearly 2 decades ago have prepared them to better handle COVID-19. Many people in both communities started wearing face masks as the first cases emerged, and without government prompting. Disinfection of high-touch areas was stepped up, but such measures were already in place at many public places. Technology helped Taiwan and South Korea get a handle on COVID-19 outbreaks. Taiwan's name-based mask distribution system ensured distribution of masks to every resident and prevented hoarding. To stop panic buying and long queues outside shops, the government launched a platform for each vendor to update how much stock they had on hand. A series of real-time mask apps were then developed for residents to check where they could go to buy protective gear. In South Korea, health officials used access to phone records, credit card transactions, and surveillance video to track down the close contacts of infected patients. Members of the public received text messages about the past movements of confirmed cases, with details including the names of businesses and restaurants they recently visited. But digital tracing or surveillance only works when enough people take part.
Many of the contact tracing approaches that have been used in South Korea, for instance, would be met with a very strong public resistance in, say, the US or the UK. So that's not always a possibility.
It's not just in those places. Hong Kong recently launched an app for people to track their movements. But concerns about privacy and complaints that the app is not easy to use have resulted in a lukewarm reception. And even with its sophisticated contact tracing strategy, South Korea has recently seen COVID-19 cases on the rise again, prompting authorities to reimpose social distancing measures. But why haven't other countries adopted coronavirus fighting strategies that have proven successful?
Countries that have been less successful have faced a variety of different constraints, I think, ranging from perhaps less collectivist societal attitudes, concerns about the socioeconomic costs of attempts to control the pandemic, perhaps a higher distrust of scientists, experts, or even government interventions, and then, of course, political leadership that have dismissed the impacts of COVID-19.
Health experts say a combination of politics, Unwillingness of the public to cooperate and concerns over the economy all play a role in why COVID-19 containment has failed in some places.
I think it's also been very heavily driven by this idea that there's a dichotomy between economics and health. I think that there's been this sort of conceptual argument that you really need to balance the response between the two. And that has led to a lot of half-measure responses, sort of lockdowns that were then eased too early, or trying to sort of have half-measure restrictions that allow businesses to stay open more, but still try to control the spread a little bit. And the issue is that in the middle of a pandemic, a half measure doesn't work. And the problem is that these half measures ended up having much stronger economic impacts than a short-term strong impact.
As much of the world struggles to recover from economic recession as a result of the pandemic, Taiwan expects to finish 2020 without experiencing any economic contraction. And before South Korea's latest wave of COVID-19 infections, the nation's businesses were able to continue trading. COVID-19 is something the world will have to continue dealing with in 2021. Even with the rollout of new vaccines, which could take more than a year, the coronavirus will be with us for the foreseeable future. But in the new year, will governments in the worst-hit areas change their strategies? Or will their people be willing to accept more drastic measures to fight the pandemic if they become necessary?